Welcome to the deep dive. Today, we're looking at the huge rise of digital health tech. Fitness trackers, smartwatches, even complex hospital systems. They all promise better health, right?
Mhm.
Empowering us, refining diagnoses.
Absolutely. But with that kind of power comes quite a bit of responsibility. And today we're diving into some critical ethical and safety issues that maybe get overlooked sometimes, even though this tech is everywhere now.
Yeah, it's a big topic. We're talking about the risks tied to the technology itself, potential dangers to user safety, big questions around security and privacy, too.
And transparency, accountability, those are key.
Definitely. It's a lot to unpack.
Our goal really is for you listening to come away feeling informed, maybe more empowered to look critically at these tools and understand what safeguards we actually need.
Okay, so let's get into it. Our sources show that while these digital tools aim to help, clarify health stuff and manage self-care, there are real risks.
Right, it's not just about a device breaking down.
No, it's more subtle. Like maybe not enough training for the user or people using the tech in ways it wasn't intended. And the really quiet danger. Apps that seem harmless but give you, well, dangerously wrong data that can steer you towards bad health choices without you even realizing it.
And a crucial point you touched on there, many of these apps aren't technically medical devices,
Exactly. So they often skip any real regulation.
which has knock-on effects. If an app isn't regulated, maybe you start self-diagnosing based on data that hasn't been checked or validated.
Delaying actual medical advice.
Potentially, yeah. Or think about bringing that unverified data to your doctor. That creates a whole new challenge for them. It could even lead to overdiagnosis or overtreatment, unnecessary prescriptions, complications, using up resources.
So the patient kind of becomes their own diagnostician, but with possibly flawed tools, and the risks go beyond just bad data, right? There are safety and well-being issues for users, too.
For sure. Proper education on how to actually use this tech and how to interpret the information it gives you is so important.
Especially with the digital divide, not everyone has the same access or comfort level with tech. Older patients, some disadvantaged groups,
They can get left behind, yeah. Which could make health outcomes worse, not better.
and the design itself.
Well, that's another layer. They're often designed to be really engaging. They tap into our brain's reward systems.
Like addictive social media.
It can lead to similar behaviors, yes. There's research linking heavy smartphone and internet use to things like poor sleep, anxiety, depression. Imagine your phone constantly pinging you with health updates. It could actually just ramp up your anxiety. Information overload.
And that passive monitoring idea, where you think you're being watched over constantly.
Right. It can create this false sense of security. You assume someone's keeping an eye out, but it might just be the tech itself, offering pretty limited clinical insight.
Okay, let's switch gears a bit to security and privacy.
Yeah.
Because this tech collects so much detailed data.
Continuously. Health stats, where you are, maybe even body language analysis.
Mhm.
It's incredibly granular.
And the idea that it's anonymous.
That's often a myth. Your supposedly private health data, when you combine it with all your other digital footprints, well, it often isn't that hard to piece together who you are, exposing way more than you intended.
Cyber attacks are a real threat here too, aren't they?
A growing one, definitely. Think about someone maliciously hacking an insulin pump to change the dose.
Wow. Or a pacemaker.
Life-sustaining devices. The risk to patients is huge, potentially immediate. And beyond direct harm, think about data misuse. Like, could employers use data from workplace wellness programs? Maybe encouragement slowly turns into coercion.
That's worrying. So strong data security rules like GDPR in Europe or HIPAA in the US are vital.
Absolutely critical, non-negotiable, really.
Which brings us to transparency and accountability. It seems obvious, but we need clarity on what data is collected, how, when.
But it's often a black box, isn't it?
Yeah.
Especially with algorithms developed by private companies. They're trade secrets, intellectual property.
And they change. They learn and evolve over time.
Makes it even harder to track.
Yeah.
And then the big question, if something goes wrong, who's accountable?
Is it the doctor, the hospital, the tech company?
Exactly. Those duties and obligations need to be clearly defined and communicated up front. And informed consent needs to be more than just clicking "I agree." It should really explain all the data involved, how it's stored, who sees it, its potential for error.
So pulling this all together, we've seen the amazing potential of digital health tech, but also some really serious pitfalls.
Yeah, from unregulated apps leading people astray.
To hidden data risks and even cyber attacks on critical devices like insulin pumps or pacemakers.
Addressing all this, it really needs more awareness, proactive strategies, Better education for users so they understand the tech.
Mm-hmm.
Robust data security, like those GDPR and HIPAA examples. More transparency from developers about their algorithms and data practices.
And clear lines of accountability when errors happen. So as you listening interact with health tech, maybe your smartwatch, maybe an app, think about it. What kind of relationship are you building with these tools? Are they truly empowering you? Or is there a risk of just being passively monitored, maybe even overwhelmed by it all?
Which leads to a final thought for everyone, really. What steps can we take, individually and together, to make sure our personal health data actually serves our well-being and not, just the interest of the technology itself?